Hello everyone, I'd like to first start by acknowledging the traditional custodians of the lands we are all meeting on today, in my case the Bundjalung people, and pay my respects to elders past, present and emerging. In February this year I started my PhD with the George Institute and the Prevention Centre, and my PhD is situated within a larger Prevention Centre project investigating ways of activating NCD prevention provisions under the South Australian Public Health Act, specifically by developing codes of practice. And today I'm going to be presenting for you my preliminary examination of the use of codes of practice to better understand how public health law can be used to address overlapping systems of NCDs and climate change. But before I go any further, I'd like to acknowledge our partners, including South Australia Health, who are key partners in this project. As many of you know, there is a growing body of research demonstrating that the environment has implications on human health, and that the burden of NCDs will be exacerbated considerably in the near future as a result of climate change. This was recently highlighted in the Lancet Commission report on the global syndemic of obesity, undernutrition and climate change, which defines syndemic as a synergy of epidemics co-occurring in time and place, interacting with one another and sharing underlying societal drivers. Modern relationships between the environment, food and health are complex and present serious high-level policy challenges. This is due to their overlapping systems which require cross-portfolio or whole-of-government policy action to achieve the greatest impact. For example, food production and land use have implications on access and affordability of nutritious foods, which is threatened by severe weather events resulting from climate change and exacerbated by commercial waste due to lengthy transportation across Australia. One prevention mechanism that can be used to address these systems is public health law. Public health law can be used as an effective prevention mechanism as it provides governments with the power to improve population health. It has traditionally been well used to achieve cross-portfolio action in communicable disease prevention, injury prevention, including workplace health and safety, food safety, road safety, and even tobacco control is another example. Yet it's often underutilised more broadly in NCD prevention, and despite having the potential to directly and indirectly impact on health and the environment. There is one jurisdiction, however, who are pioneering the use of public health law for NCD prevention and environmental sustainability, and that's South Australia. They are the first and only jurisdiction in Australia to include NCD prevention provisions in their Public Health Act. It is also the first act with a sustainability principle and object on creating and maintaining a healthy environment. This kind of focus on public health, social, economic and environmental factors is rarely embedded in objects of acts and is uncommon even in planning laws. This makes the South Australian Public Health Act extremely novel and this area of work quite novel as well. Unfortunately, these provisions remain inactive until operationalised by the Minister through issuing codes of practice, and this is yet to be done. So under Part 8 of the South Australian Public Health Act, codes of practice can be issued in relation to preventing or reducing the incidence of NCDs. Specifically, codes of practice can be issued on the way in which specific goods are marketed, distributed, and made available to the public. So to gain a better understanding of how public health law could be used to address the overlapping systems of NCDs and climate change within South Australia, we need to gain an understanding of how codes of practice are used more broadly, as not much is known about their use by governments or what makes them powerful, evidence-based or an effective regulatory instrument. Codes of practice can be issued by governments or industry as their mechanism for regulation. However, when reviewing the literature, there is no clear legal definition of a code of practice, and codes often seem to be used interchangeably with other terminology such as guidelines. And industry likes to use terms including initiative or scheme. When we look at common definitions of other terms, a standard outlines mandatory rules, a procedure sets out the process to implement or enforce the standard or policy, and a guideline provides advice. Guidelines are thought to be less prescriptive than codes of practice and voluntary in nature. However, this does not always appear to be the case, as guidelines are sometimes used interchangeably with codes of practice, and they can sit under legislation. For example, liquor promotion guidelines sit under liquor regulations. The way in which these instruments are used varies by jurisdiction and by industry, which could be why these terms are often used interchangeably. Some codes are very prescriptive, while others are more open to interpretation. They also vary in length and sometimes are written out as a guide or handbook rather than legal text. However, the aim is similar: to provide a practical guide for meeting obligations or recommendations, and they're used as a method of regulation. They may also be used differently because of the different governance or regulatory frameworks that are operating. When looking at Braithwaite's responsive regulation pyramid, you can see there is a hierarchy of regulation from mandatory standards or legislation to voluntary compliance. And I'm going to present some case studies on government and industry codes that sit at different levels of the pyramid. The first is an example of self-regulation. It's the Food and Grocery Peak Body's Responsible Marketing Code, which restricts the way goods are marketed to the public, specifically the way unhealthy food and drinks are marketed to kids. The second case study is an example of a standard with discretionary punishment. The Food and Grocery Code of Conduct is a voluntary industry standard prescribed under the Competition and Consumer Commission Act. It's an example of a code that applies to an entire business sector, in this case the food and grocery sector, and provides a framework for dealings between retailers, wholesalers and suppliers. The third case study is an example of a mandatory standard. Like the Public Health Act, South Australia's Liquor Act empowers the Minister to issue codes of practice. One code that's currently operational is the Late Night Trading Code of Practice, which aims to reduce alcohol-related violence in and around premises late at night. And this code restricts the way that goods are made available to the public. When looking at them together, you can see the differences in the codes. The Responsible Marketing Code is voluntary, it's administered and funded by the food and advertising industries, and it relies on a complaints-based monitoring system. The Food and Grocery Code is also voluntary, but it's administered by the ACCC and funded by the government. However, the Australian Competition and Consumer Commission only handles systemic-wide compliance issues. One-off disputes are to be handled internally by mediation and arbitration at the cost of businesses. Whereas the Late Night Code is mandatory, it's administered by the liquor regulator in the Attorney General's Department, and they conduct proactive monitoring and compliance. So let's have a look at these in a little more detail to find out why they vary in effectiveness. Industry reviews of the marketing initiative suggest that compliance with the code is high. However, the voluntary nature and lack of proactive monitoring and enforcement makes it difficult to know the true level of compliance. Independent evaluations of the initiative have found that it's ineffective due to inadequate definitions for when and where food marketing to children can occur. It has permissive definitions of foods considered appropriate for advertising, and it excludes persuasive marketing techniques that are appealing to kids. Fundamentally, though, the main objective of the initiative is limited, as the narrowly worded provisions require that marketing not be directed to children, rather than reducing the overall exposure or ensuring that marketing is not appealing to children. This means that cartoon characters can be used to advertise chocolate so long as it's under the guise of invoking nostalgia in adults, and therefore that's considered to not be directed to children. The initiative is a source of market failure as it allows the industry itself to draft the ground rules, and there is no incentive for them to cover the loopholes and be stringent in the way that they've drafted the regulation. The system enables businesses to be in compliance without necessarily promoting the social or public health intention of the code. And there's a clear conflict of interest in this form of self-regulation, as the business imperative, selling more products, is at direct odds with reducing marketing. When looking at the Food and Grocery Code of Practice, a government review of this code found that it was difficult to determine if the code was effective, mostly because of the lack of signatories. Only 4 signatories. There's only 4 signatories in total to this code, and they're all major retailers. But the review also suggested that the voluntary nature was sufficient because the signatories made up 75% market share and therefore captured a large part of the industry. However, it could be argued that these large retailers, Coles, Woolworths, Aldi, they're signing because they have the market power and the resources to handle internal disputes. There's very few mechanisms in place to support smaller retailers and suppliers. And interestingly, this code is the only voluntary industry standard under the Competition and Consumer Act, and it's got no direct focus on the consumer. The objective of the code is to provide a framework for business dealings, for example, supply agreements, delisting products, and quality and acceptance of fresh produce. However, the code's not very prescriptive and does not set out any processes for implementation. Rather, it encourages negotiations to be managed in good faith. And this can have some inherent problems in it, as there's no minimum standard. So if you consider fresh produce, that means that there can be inconsistencies between retailers and the possibility of rejection of good quality fresh produce because it doesn't meet subjective standards. The lack of focus on the consumer limits the scope when there are clear opportunities to use these agreements to ensure availability and affordability of healthy foods, as well as reducing food waste. The late night code, on the other hand, is prescriptive and specific in that it only applies to liquor licenses trading past 3 a.m. The review of the code found that compliance was high, and consultations with researchers, stakeholders, licensees in the community found overall support for the code. The requirements of the code are evidence-based, and they encourage the creation of less risky business models. Overall, the review found that the code was effective at achieving its objective, which was to reduce late-night alcohol-related offences, violence and harm. And it also found that it improved local amenity and created safer and healthier environments, and that it achieved its objectives in minimising harm and ensuring that the sale and supply of alcohol is within community expectations. So what lessons can be learnt from these codes and applied to the development of codes specifically focused on NCD prevention and environmental sustainability? So firstly, the effectiveness of codes can be limited by narrowly worded provisions and a lack of clear measurable objectives. Independent compliance monitoring improves the effective operations of the codes of practice and promotes transparency. Self-regulation must be considered within the context of conflicts of interest, and clear, enforceable, evidence-based guidance is critical for the enactment of public health. All 3 case studies demonstrate the different regulatory approaches that can be used for codes of practice. And when we go back to the syndemic framework, while none of those case studies set out specifically to address NCD prevention and environmental sustainability, they all do impact on both of these systems. For example, the late night code affects public spaces, norms, and even hospitals in terms of reduced violence. Under the South Australian Public Health Act, codes of practice can be issued on the way in which specific goods or services are marketed, distributed, and made available to the public. They have the best chance of being effective if they proactively consider human health and well-being and ecological health and well-being from the outset, if they're founded in evidence and have some level of accountability and are prescriptive enough to achieve the objectives without creating loopholes. So where to from here? So this is obviously just a preliminary examination of the literature, and my next step is to turn this into a systematic literature review. And the aim here is to really translate regulatory theory into practice, and it's great that there's this example of infrastructural public health law for us to really draw on and have practical implications. Another area of research which is being conducted as part of the larger Prevention Centre project is to identify priority areas for issuing codes of practice, and can start by looking to what's already been done and what can be built on. And for example, could have codes of practice on marketing, codes of practice specifically for schools and creating healthy school environments, or even on procurement for government departments. And if you have any questions, please email me mday@georgeinstitute.org.au, and I'd like to thank my supervisory team for their amazing support. Thank you.